lots of advanced statistical methods have been developed for data analysis that can be readily applied to pediatric studies. In my presentation the day before yesterday, I talked about the latent class and latent profile analysis. Today I'm going to talk about another new method called the plausible value of latent variable. What is a latent variable? That means unobserved. You have a theory about some kind of a construct. Say, for example, depression, anxiety, people's belief, ability, that kind of things. It's just a construct. You cannot directly measure these things. It's a latent variable. What you can measure is some kind of indicators of this variable. For example, depression. You ask a question, many questions like, do you feel blue recently? Do you feel you're hopeless or something like this? Each of these measures is an indicator of depression, but none of these measures is a perfect measure. Everyone has measurement errors. So usually a construct or scale has multiple items. Some construct, the instrument, you can say some scales consists of a huge number of items. More than 10, some more than 20. So when you have this data ready, this information collected, how do you analyze this data? Too many variables. You only want one measure, say depression, but you have a long list of indicators or observed variables. So we need some kind of data reduction approach to get a single measure of the construct, like depression, anxiety, or quality of life. Then it will be much easier for your data analysis. So there are lots of methods for this kind of data reduction. Traditionally, you have, say, total score. People use total score. Some of the item scores, factor analysis, or principal or components, or this kind of methods. Those methods have some limitations I will talk about briefly later. But the plausible value of latent variable can do better. So as I said, there's some construct, lots of mental disorder measures, quality of life, symptom domains, function domains, lots of measures. You need multiple items, ask multiple questions to measure this kind of latent construct. The challenge is too many variables to handle. Okay. The data reduction approaches, total score, as I said, sum them together, that's no good. Okay. Why? I will talk about that later. Factor score, LLT score. LLT means that stands for item response theory. It's kind of a factor analysis with categorical indicator measures, non-plausible values. Now, what are the plausible values of latent variables? That's a set of generated values of these latent variables through imputation, say Markov chain Monte Carlo Bayesian approach to generate a set of values for latent variables. Why we use these variables? Because total score cannot take into account the measurement errors. So when you have a scale, usually you use a compact alpha to test the reliability. So the cutoff point is usually 0.7. So you got a compact alpha greater than 0.07, 0.7. So, oh, this is good, I can use it. And the reviewers would buy it. 0.7, 0.75, 0.8, even 0.8 or 0.9, oh, very good alphas. You know what? Still you have 20% or 10% measurement errors. And the measurement errors cause bias in statistics analysis. Factor analysis, including the IRT, you can estimate the factor score, save it, and as a kind of observed variable for your data analysis. Okay, that's a very normal practice. But if you want to include a latent variable estimate from factor analysis, which is a measurement error, into a structure equation models, you end up with a huge model specification. I will show you an example of what happens. You very often encounter a fatal error, very difficult to handle. But if we use the scores estimated for factor analysis or IRT, and use it as a observed variable, so as a dependent variable, in your further analysis, secondary analysis, the slope coefficient is biased, estimate is biased. So a better approach is to use the new plausible value of a latent variable. How to use the latent plausible value for secondary analysis? First of all, you imputed this plausible values. There's a package, or statistic package, say M+. You can estimate these values, then save it, and then use it for further analysis. However, when you use this plausible value for secondary analysis, it is not just one set of values. You need multiple set of values, so minimum of 5. And analysis multiple data sets simultaneously. This is just like a multiple imputation approach, right? If I have missing value, you use multiple imputation to generate the missing values. You cannot use just one sample. You have to use multiple sample or MI samples to do analysis. Same idea. So for example, you have a K set of these plausible variables. The parameter estimate is the average of the K models. Parameter estimated from the K data set. The mean parameter is just the average of these parameters. But the variance is not just the average, it is a weighted average. So it's hard to understand all the details about this kind of a new technology. However, once the package is ready, you just use it. Just like a computer. The CPU is very sophisticated. We don't have to understand what's going on inside. But once you have a computer, you just use it for whatever you need. The double-E engineers can develop, can design very sophisticated CPU motherboard, but maybe they are not good at typing. A secretary can do better than that. So application is different from that kind of very detailed, high-tech kind of things. Package is ready for you to use, like M+, to apply this kind of advanced methods. So my demonstration is going to use a sample from drug user samples from China. That was my project a couple of years ago. So now I used to study. I do research in risk populations, risk behaviors, but in the past 80 years, I switched to pediatric studies. So this sample has 303 cases. The outcome measures BSI 18. There's a brief symptom inventory. That has 3 domains: somatization, depression, anxiety. Each one has 6 items. And then I have a bunch of predictors, social demographics, and drug use as predictors. So this is, let me make it smaller. I think this is not something new. It's just factor analysis. With this BSI 18, we have 18 indicators, 3 domains, that means 3 latent variables, 3 constructs. Each one has 6 items. We estimate that this confirmatory factor analysis, which is a measurement model, we can test whether this measurement model fit data. In this example, yes, it does fit. So looks like I can integrate this measurement model into structure equation model. That is my theoretical model. Okay, social demographics influence this 3 theoretical construct, and also through drug use. That is the mass use in the past 30 days. I wish I could estimate this model and get a result, and then I would be very happy. However, what happens? Residual covariance matrix is not a positive definite. What does it mean? That residual matrix is not reversible. Thus, we cannot estimate the residual variance covariance. This is a fatal error. Very often, this is caused by small sample size, because I have too many variables involved. Thus, there's a lot of parameters you need to estimate. For the 18 items, so each one has factor loadings on these latent variables. Each one is a parameter. So this is a error term. The variance is 18 items, 18 parameters. Possibly there's a correlation. So each pass coefficient on this residual term, a lot of parameters. And the rule of thumb for this kind of structure equation model is 10 observations per parameter. The sample size is 303, so many parameters. So estimation, model estimation, is often cannot be done appropriately. So what I can do, I simplify it. This is just 3 single measures of this construct, latent variables. Now it's not latent variable anymore. So very often people use total score of those 6 items for this measure, total score of 6 items for this and this. The model is simplified. Of those measures in square, are observed variables because we already estimated these three dependent variables. They are observed already. Methamphetamine is observed. So this model, of course, not difficult to estimate. However, as we know, if I send this study with this model to a top-level review journal, the reviewer will give me difficult time. You do not handle measurement errors. If I say, oh, this is factor score. Factor score as dependent variables, you cause the slope coefficient are likely to be biased. Then it's hard for me to respond to these kind of comments. A better approach, I don't use a factor score. I don't use a total score. I use a plausible value of latent variables. Instead of a model like this, I use a model like this. So allow this cross-factor loadings free. So in this model, all these cross-loadings are forced to be fixed at 0. Now I let them free and assign a non-informative prior using Bayesian approach to estimate the model. Free this cross-loading parameters or cross-factor loadings. And then the model fit posterior predicted p-value, PPP, is 0.45. The ideal p-value is 0.5. This is 0.45, very close. That means fit very well. Unless this one is less than 0 or very close to 0, the model fit is acceptable, but this is very good, close to 0.5. I do not estimate just one set of data, the plausible value for these three constructs. Instead, I generate 5 sets of the data. 5 will be enough. Of course, you can use more, so 10, 20, but usually 5 data sets will give you pretty much good results. And then I use the plausible value for these 3 dependent variables, or you call the endogenous or dependent variables. This model fits data very well. That means I fit this model 5 times. Every parameter is averaged from the 5 model estimate. Of course, the standard errors are weighted average. So this example is based on the continuous latent variables. These 3 are continuous latent variables. But the same approach can be applied to categorical latent variables. So the presentation I did the day before yesterday was about categorical latent variables. That means it's not factor scores, but you get different latent groups, latent classes. Say each class has an individual with similar outcome measures, but different from other classes. Then these methods can also apply to this kind of categorical latent variable. You estimate from latent class analysis, latent profile analysis, or Bruce mixture models. That's for longitudinal data. This is very important approach for your data analysis, particularly for trajectory studies in longitudinal research. Let me show you an example. This is a study when I was in the Wright State University, Ohio, long time ago. We had a project, natural history study. We followed a huge number of drug users for 10 years. Then this study is based on almost 8 years observations. So if we look at this outcome measure is stop crack cocaine use in the past 6 months. So each time interval is 6 months. So if we look at the trajectory, this is overall. This is the board lines overall. So over time, during this observation period, the percentage of stop using crack cocaine increased. Pretty good, right? It's not bad. The situation is improving. The government official would be happy to see this. However, some stories behind this is unknown unless we use some more sophisticated methods to find out. So we use mixture modeling, the latent growth model. We identified 3 groups with different trajectories. You see, this group 3, this is a pretty good one. This count about 15% of people. So in the end, close to the end of the observation period, the chance, the probability of stop using is about 0.9, very good. However, this only count 15%. Another group 2, you see, still not bad. People are likely to stop using crack cocaine. The probability is over 0.4. However, look at the group Y, flight. People in this group did not try anything to stop use. And this count for 63% of the sample. We did not know this kind of distinctive trajectory. This is a population heterogeneity. We did not know. Traditional methods only tell you this, assuming homogeneous population. This overall growth curve or trajectory is not very optimistic, but you feel not too bad. But if you look at this group, majority of this population, they did not try anything to stop using drugs. And our intervention, our resources should focus on this group instead of doing something, intervention for everyone you can reach. We need to reach out and find out this group. And this group membership can be identified and surveyed and linked to the original data set to find out the characteristics of this group members. Who are in this group? Then our intervention can focus on these people. And a better approach is to use plausible value of latent variable to estimate the group membership and survey it and link it to the population to the original data set. So this can be done just like the same approach as I showed in my example. So summary, the data reduction is often needed in many studies, including pediatric. Okay, pediatric is special right? Pediatric study. When some unobserved theoretic construct is measured using multiple indicators. And this method is better than traditional ones. I think more newly developed and advanced study methods should be applied to pediatric studies. When I came to the Children's National Medical Center 8 years ago, many very common, almost every investigator use traditional approaches for data analysis. So I tried my best to help my colleagues to integrate newly developed methods into their applications, and they're doing better and better. To my experience, I think NIH does encourage investigators to use more advanced methods in their proposal applications. We have been very successful in recent years. So our NIH applications, I think is much better, and the successful rate is much better than average, much better. Okay. Any questions?
Thank you so much for this very sophisticated presentation.
Thank you.
It's too many maths, I believe, for physicians. Okay, but it's very important as a tool for research, and mostly in an area as psychiatry, in which we don't have many signs or we don't have any objective ways to approach our patients. So I would like to ask a question, and my question to this model is, have you applied this on pediatric psychiatric populations?
Pediatric population, actually, the population we study in our hospital are children and adolescents.
Okay.
In the past 5 years, my colleagues and I have, let me see, 8 R1s on different topics among children and adolescents, including nursing studies, palliative care, diabetes studies, wide range of topics.
Okay. So thank you so much. If we have no other comments or if we have no other questions,